Question. How often would you take into account doing like a steroid epidural or something like that versus surgery? How often do you actually do epidurals for treatment of back pain and inflammation?
Yeah, so I'll be honest, I don't tend to do them that often if the compression is really bad, because oftentimes if we can treat them surgically and topically treat them in surgery, I think they do a lot better longer term. I have had a couple dogs though that have had LS surgery, and those were some of the ones where I thought that they started putting down scar tissue pretty quickly, probably because of what was going on with their bodies to start with. I've had some of those that we've treated with epidurals, and that helped cure, the inflammation associated with that scar tissue. So I think for me, part of the issue is just the duration that they last for. And so oftentimes with epidurals, if they're really painful, I feel like sometimes we get a week or two before they're back in the same situation. So, and so by the time you've gone through like multiple epidurals over time, you probably could have just done surgery if it was something straightforward. But so that's coming from a neurosurgeon perspective. So it might be a little different.
We have a question about how common is discospondylitis as a cause of back pain. Do we have a sense about that?
Yeah, so I think it's very common. We get these kind of different dichotomies of discospondylitis. And so we see it very commonly in older dogs that have these osteoarthritic changes in the spine. And some of it is that they're prone to other things too. They're prone sometimes to urinary tract infections, and those can seed into the disc spaces. So we have this group of older animals. And I think those ones are the trickiest ones to determine that they have that, because they've already got other chronic reasons for pain. And then these discs get infected. And it's sometimes hard to tell that gradation between their chronic spinal osteoarthritis pain and then moving on to this more inflammatory type of pain. And so I think a lot of those guys get missed for a long time before they get diagnosed, versus we have another subset of disco that tends to be younger dogs. And those ones are a lot easier to pinpoint. They're oftentimes more inflammatory. They're febrile, they're hyperglobulinic, so they have other kind of indications that they're systemically inflammatory. So, but the older ones I think are definitely missed a lot of the time. So.
We had a question pre-submitted about a dog who has a diagnosis of spinal arthritis. I guess this could apply to any body part. This animal loves to lay in the sun. Do any of you all recommend the use of heating pads? Is heat of that type helpful for these animals?
Dr. Bartley, you might know better than me about whether heat helps. I know that I feel like at age 42, I have spinal osteoarthritis and I lay on a heating pad all the time and it feels amazing. So that would make sense to me, but I don't know specifically. It could increase flow and stuff. So I imagine it does help.
So I like the question. I think it's wise. I'm careful specifically about heating pads. Gosh, I think I was kind of educated to not use heating pads particularly when animals are not very mobile. And if they can't get off the heating pad, what I would say is it's important to let them choose, let them tell you. And so what I commonly, if we use heat, I will exactly that, use like a microwavable bag or something that I can hold on my skin for 3 to 5 minutes. And I know that I'm not getting too hot. And so if you can refine that process, I think it's reasonable to try heat. And I think particularly back pain seems to be, for me, also helpful. That is actually kind of some of the same thermal type and energy focused therapy that we get from laser. Although not all lasers are heating, that same process of bringing blood flow could be healing and pain relieving. So it makes sense. Ice for joints, right? We know, I happen to have slammed my finger in the door today. Ice is immediately pain relieving. And so depending on the condition, you might choose one or the other. Just let the animal tell you what they need.
Very helpful. We're going to get into some medication questions. This was pre-submitted and a great one. A dog that has an established diagnosis of osteoarthritis has been prescribed gabapentin for pain. And the question is, and I think Dr. Windsor might have touched on this a little bit, should it be given as needed when the dog is demonstrating signs of pain, or is a daily maintenance dose to stay one step ahead of the pain recommended? What's typically advised and rationale?
Yeah, exactly that. It has to already be there waiting. So the way that I explain out to people is that you have these pain pathways that are getting sent through the spinal cord, and the gabapentin stays there and waves its hand and stops it from coming through. And so if the pain signals are already coming through, the gabapentin can't chase after it. It has to already be present at the receptors. And so, for some dogs too, and cats, depending on the degree of pain they have, they might need a different frequency or different dosing. And so I think oftentimes I'll have clients that either use it as needed or they give it once a day. And for gabapentin, that's just not going to be enough, for most animals. So for that reason, pregabalin is nice because you can give it less frequently for a lot of them, but definitely I use it as a chronic daily medicine. I don't know how you guys feel, but
I'm the same. I use it. If I'm going to put a pet on it, I want it to be there. And so, an NSAID I'm happy to use more on an as needed basis or taper down to a lowest effective dose, but gabapentin I tend to do in a more, will stay at this dose range.
Terrific. Another medicating question, and I know Dr. Fry is going to talk a bit about this therapy, but do any of you presenters use subcutaneous ketamine instead of or in addition to amantadine in your practice?
Yes.
Yeah, it's in the beginning.
Yes.
The answer is yes. Unanimous. Yes, absolutely.
And I know, yeah, go ahead.
Yeah, I think the reason you get a short answer is that we don't know. There are not any good studies that tell us what a protocol really should be involving that technique. And so there are some kind of articles out there that talk about using it every day to weekly to monthly as a sub-Q injection to use ketamine, and in addition to animals that are already on amantadine. So I think we all have some experience because we are trying to stamp out chronic pain, but there's not a great suggested protocol at this time that I'm aware of. Dr. Johnson, you may know more.
Yeah, that's exactly right. I think that Dr. Fry will probably talk about this quite extensively, but we all have been using IV infusions of ketamine following human protocols for many years. And the idea of using subcutaneous was so exciting to know that this could have an effect and we wouldn't have to hospitalize a patient. So I think that we've all been working with just anecdotal evidence, and I'm hoping there'll be some good publications soon.
Awesome. One last question. I know that you may have touched on this also, Dr. Windsor. Is pregabalin as effective as gabapentin? And is there any difference in the drowsiness it causes?
Sure. Yeah, I definitely think it can be as effective. I think every dog's a little bit different how they respond. So I think anecdotally, I've had some dogs that have had not even necessary sedation, but just behavior change, like aggression with pregabalin that they haven't had with gabapentin. And so what I'll usually do is just kind of determine what's going to work best for the owner convenience wise, because oftentimes just the lower frequency of dosing for pregabalin makes it easier for people to do. And so some people have already been on gabapentin. So if they're already on it and it's working for them, I'm hesitant to switch them over. But yeah, I don't know other people's experience with pre-gab, but I use it a lot for seizures as well. And so the dose that I use for seizures is a little bit higher than I would use for pain. And so some of those side effects I see more with the seizure patients too.
Terrific.
Sometimes they have both, and I love it because I'm like, great, you can have it for your epilepsy and for your LS disease. So
There you go.